client services window where we do a request for services form, just like a doctor's office.
Not everyone is dissatisfied with the Texas Legislature's decision last year to reduce family planning funding, like the state's crisis pregnancy centers, which were the recipients of some of the redirected funds.
We laughed because when we were decorating, we wanted peaceful, we wanted upscale.
CYNTHIA WENZ is CEO of The Source, a Houston-based center that provides counseling and medical help to any woman who walks through their doors.
The Source for Women is a pregnancy medical clinic. We serve abortion-vulnerable women in their time of perceived crisis. Basically, any life circumstances that are facing her that force her to believe abortion is her only choice. We're the clinic that basically says, take a deep breath, slow down. Let's actually explore all of those options.
But nearly 200 miles northwest of here, in a working-class neighborhood in East Austin, it's a different story. The nonprofit People's Community Clinic is reeling from a loss of family planning dollars. CEO Regina Rogoff says the state ended their long-term partnership in September.
Well, it was a pretty momentous occasion when we learned that we were going to lose $526,000.
People's, a comprehensive care clinic that doesn't perform abortions, didn't just lose a consistent source of funding. It lost discount pricing on contraceptives. Now it's paying 4 times more for it and passing off some of the cost to a patient base that's already struggling to afford basic women's health services.
To lose that much of your funding, if that was your exclusive service, could have shut us down.
Other former state contractors have been less fortunate. Since September 2011, Planned Parenthood has shut down 12 of its family planning clinics. Women's health centers statewide, many of them unaffiliated with abortion providers, also closed. For years, there have been several sources of funding for family planning in Texas. The Department of State Health Services administer federal block grants known as Titles 5, 10, and 20. That's where funding to providers was slashed by 2/3, ending access for an estimated 150,000 Texas women. The Health and Human Services Commission, meanwhile, oversees federal Medicaid funding and the Women's Health Program, a $40 million per year program the state has recently taken over from the feds in order to exclude abortion affiliates like Planned Parenthood. Ann Dunkelberg, the Associate Director of the Liberal Center for Public Policy Priorities, says the cuts are significant because the women served by the various programs are different.
They serve some of the lowest income, uninsured Texas women through our Medicaid program. But the family planning funds that go through our state health department in the form of federal block grants and state funds, those actually help a wide range of incomes, lots and lots of young and working class women who are uninsured rely on family planning programs to get an annual checkup.
During a long debate on the House floor, Republican lawmakers shifted more than $60 million in federal block grants from the state health department's family planning programs to other causes, including the Alternatives to Abortion program, which funds crisis pregnancy centers, early childhood intervention, mental health services, EMS and trauma care, and disability programs for the deaf and blind.
I don't know that I've seen this tactic used on this scale ever before. The across-the-board budget cuts in the rest of our state budget were, 1% to 5% of any given program. This was 66% cut. So there was nothing, it wasn't part of just across-the-board reductions due to funding shortages. It had other aspects to it.
Texas Right to Life Executive Director Elizabeth Graham says behind the scenes, her anti-abortion group spearheaded those policy changes because they believe family planning money is fungible and helps to keep Planned Parenthood in business.
Several years ago, legislators started asking the Health Department and Texas Right to Life to look for ways that the abortion industry in Texas receives funds. And so we took on a 5-year research project and identified where the family planning funds are going, how abortion clinics are receiving their money. And so the legislators responded to that and said, we're going to take all money that goes to abortion clinics and redirect that to other healthcare programs so that we can serve a broader spectrum of citizens in the state and so that we can fund programs that are less controversial.
Graham says the Alternatives to Abortion program, overseen by the Texas Pregnancy Care Network, was on the chopping block before House GOP lawmakers saved it by taking $8 million from family planning. CYNTHIA WENZ says this means The Source, a Christian-based network of crisis pregnancy centers, will receive up to $90,000 a year.
It's a very small part of our annual budget, and we reimburse for services. Basically, the program funds educational services, which is critical. We see a lot of women in crisis pregnancies that are cyclical, meaning this is their third or fourth crisis pregnancy. Education is critical in breaking those cycles.
Since the Texas Pregnancy Care Network launched in 2007, their client base has quadrupled to more than 16,000 women. Like many other crisis pregnancy centers, the source offers free counseling and ultrasounds. It helps women sign up for food stamps and Medicaid. Diapers and baby clothes are readily available. However, WENZ says they are setting their sights on becoming a medical clinic by year's end that offers on-site STD testing and gynecological exams. Nurse manager Lauren DESPAIN says the source is looking to set an example, especially as the Texas Health and Human Services Commission tries to exclude Planned Parenthood clinics from the Women's Health Program and is actively searching for new providers.
To go from the CPC, the Crisis Pregnancy Center, to a pregnancy medical clinic is the trend, is what we're hoping that we emerge into. It's where we actually are able to provide expanded medical services and be able to just raise the bar for care, that we have qualified volunteers, that they are following laws, that we're following HIPAA and following national standards for healthcare.
There's a lot of statistics that need to be thought out and researched before a woman makes a choice.
CYNTHIA WENZ says they don't coerce. They try to counsel women to consider what they call life-affirming choices, no matter what their circumstances.
I can't afford it. My boyfriend's abusing me. I don't have a job. I don't have a home. I don't have a car. We hear that all the time. And as a matter of fact, 96% of the women who think abortion is their only choice is simply because they don't think they can afford that child. And it's not true. It's not true. We've all had challenges in our lives, and we're all stronger for them.
Some lawmakers question the efficacy of crisis pregnancy centers over prevention, saying birth control is the best way to prevent abortions. Graham disagrees. She says she believes birth control often leads women to abortion clinics.
The numbers go up because women who avail themselves of contraception and birth control are so surprised to find out that they're pregnant that they're the first ones to take advantage of the availability of abortion.
Even within the anti-abortion movement, there's plenty of nuance around family planning. Carol Everett is the founder and CEO of the HEIDI Group, a nonprofit organization that helps women dealing with unintended pregnancies access resources. Though she opposes Planned Parenthood, she said she was dismayed by the funding cuts to women's health services.
They thought they were doing a great thing because one pro-life advocate told them how good it would be to end birth control. I am not against birth control. Here this little girl came to me and said, Carol, I have a baby, I'm 16 years old. All my life, all I've ever wanted to do is finish high school. And if you don't give me birth control, I'm going to be pregnant again. I know the reality of what's happening. And the reality is I would rather not give birth control to an unmarried 16-year-old. But I don't want her to get pregnant either. And I have to make tough choices. I have to make very tough choices.
Nonprofit medical providers who've lost state funding say the legislature's decision to divert the money to other causes has fractured a system that, in their view, was working.
In terms of diverting the money to other purposes, it's hard for me to say that those other purposes aren't legitimate purposes. And I think it's sad that we pit one important societal need against another important societal need, especially when Texas is at the lowest funding level for almost any one of these issues. Kids with autism deserve to have services from the state, just like women of reproductive age who are low income and who may not be able to afford these services otherwise should have access to them as well.
Rogoff says her clinic has just become a federally qualified health center, meaning it will soon get discount pricing on birth control again. But it's no guarantee they'll be able to get state funding next session, especially since there's less money to go around. Instead, Peoples is relying more and more on the kindness of strangers, including an elderly woman from the East Coast who read about the budget cuts and sent them a check to pay for a patient to get long-term birth control. Rogoff read us the letter that woman asked to be given to the recipient.
Women who have control over their bodies have more control over their lives. I am hoping my gift will truly change your life and positively affect your future.
Reporting in Austin, this is Tan Tan with the Texas Tribune.